When you're looking for patients for the MISHA system, it can be a very broad group of people and a broad group of activities. It could be the person who wants to just work in their garden with that and be pain-free, to the person who wants to go hiking and do much more high-level activities.
Provided the patient has medial compartment degenerative changes, there also isn't an age bracket really outside the very young adolescent patients. But as an adult, I would say there's no age restriction. You can make a case to do this in a young person who has arthritis, but you can also make a case when you have an older patient who has medial compartment, even more advanced degenerative changes, and you're simply looking for a less invasive intervention, something that has less blood loss, for example.
When I started looking for candidates for MISHA, one of the things that really helped me was identifying those patients with MOXIE. It's really helped me to identify patients who would be good candidates for MISHA. M refers to medial-sided joint pain.
The patient having medial knee pain is essential. I like the one finger test in the office where I ask them, point to where it hurts, and if there's no effusion, they're pointing to the medial column. They tell me about pain coming down the stairs. They tell me about pain standing. They show me how they kind of slip to the other leg to take weight off.
O stands for osteoarthritis, which limits their ability to be active. Arthritis of all different levels, from KL1 to KL4.
What is it that you're not doing? What is it that you avoided in the last few weeks in terms of that? So I think the O for patients is important, that the arthritis is limiting their healthful activities.
X is for x-rays or imaging to confirm that they are the appropriate anatomy for a MISHA.
The x-ray is simply confirmatory. Every patient gets an x-ray in our practice. It should be recent, in 3 to 6 months, so that it's reflective of the current disease state. One of the biggest factors I look at when I'm determining whether a patient would be a good candidate for MISHA is the presence of bone marrow edema or subchondral insufficiency fractures.
But then you have others who have mainly overload with a lot of edema, and that hurt. Or you had patients with root tears, which really is a big problem in clinical practice that doesn't have a great solution.
I see a lot of patients who present with medial-sided knee pain, sometimes with degenerative meniscal tears, who want to stay active, and they're not able to stay active because of the pain. I refers to inadequate response to conservative treatment. I think what's universal is that patients have inadequate relief from the other things. That's why they're there. I think that, in combination with the fact that either the patient or the surgeon feels that they're not a candidate for arthroplasty, is critical in the sort of algorithm. We've got a lot of active older patients in their 60s and 70s who want to remain active. They want to run, they want to play golf, they want to play pickleball, they want to play tennis. And with the MISHA Knee System, we're finally able to give them an option to continue with their activities that they love. My name is Dr. E, and I've moved to MISHA.
I'm Dr. Andreas Gomoll, and I moved to MISHA.
I'm Dr. Dennis Crawford, and I moved to MISHA.